Hey, Dr. Mitch, it's the second part of the caffeine lecture. We would be able to kick it in here, actually. So here's a sample item. Which of these xanthines has, uh, which of these has the xanthine theophylline? So is it A, Camellia sinensis, B, cocoa nibs, or C, Coffea robusta? And I hope you guessed Camellia sinensis. I don't think I said sinensis. It basically is Latin for from China, right? So it's the tree from China, the shrub. Uh, and so, yeah, black tea, white tea, green tea all come from there, and those have theophylline. Cocoa nibs don't have that. They would have theobromine, and Coffea robusta obviously has caffeine. Xanthine, I may not mention, xanthine is Greek for yellow, basically. It was the color they saw in the leftovers when they were first trying to isolate the methyl xanthines. So, just a curious decision to use that for the name. And another item, chocolate liquor has A small amount of alcohol, B, theophylline, or C, cocoa butter and solids. And this one is cocoa butter and solids. Yeah, just because it's called chocolate liquor, I'm not sure how that name got developed, but it doesn't contain alcohol. The fermented beverages that were part of the Mesoamerican crowd did have about as much alcohol as a beer, but chocolate liquor does not have any alcohol in it. And then who gave us coffee? Who gave us chocolate? Sorry. Was it A, Quetzalcoatl, B, Lint, or C, Neiman? And I hope you remember it is Quetzalcoatl. Of course, it's chocolate. It's from a god. Lint was the guy who invented milk chocolate. Neiman's actually involved in cocaine. We'll get to that when we do the major stimulants. So let's solve the big mystery of caffeine's acute effects on behavior, shall we? I know you're all really wondering. So yes, caffeine effects on behavior, the feeling of mental alertness and lack of fatigue. Well documented, multiple lab studies, but we kind of already knew that. Effects on performance vary with the task. So a fine motor task, something that's going to require, doing electronics assembly or a bris or something, that's not going to be the same as just staying awake to mow the lawn or something like that. Increases vigilance and attentiveness in boring tasks. This is well documented. That Macintosh clock we talked about when we did nicotine. Um, Definitely are pretty good at the high vigilance boring tasks after caffeine, and certainly better than the placebo group. May be disruptive in more complex tasks. Yeah, so the more steps, or if they're fine motor, it's not going to do as well. There may be an interaction with aspects of personality. Extroverts may have a different blood-drug curve on it, shall we say, but it's not replicating. And then lengthens time to fall asleep. So I do want to emphasize, definitely not something you should have in the afternoon if you're going to need to go to bed. And then the last subjective acute effect I want to emphasize, it does not counteract alcohol. Right? Give caffeine to a drunk, you get a wide awake drunk. It's not going to improve the motor skills. It's not going to increase attentive capacity, any of that. It's just going to keep you from falling asleep, and that's not going to be any help at all. Mixing alcohol and caffeine actually looks like it may have some impact on aggression that alcohol alone might not have, so you really want to lay off. Oh, so I did want to make my case for good sleep hygiene rather than having that second cup of coffee in a day. So if you have no caffeine afternoon, obviously that's going to help you fall asleep. Good stimulus control. Your bed is for two things and two things only. No screens for the last 2 hours before bed. I know that's rough. Some of you take your phones to bed with you. I don't know how that works exactly, but ideally you don't want to have your retina stimulated by light under those circumstances. And make sure you get reasonable exercise in the day. Make sure your bedroom is a reasonable temperature. I don't know what it is with Americans and making their bedrooms so cold. And then make sure your bed is comfortable. Yeesh. Have a nice pillow. Have a nice blanket. Have a nice sheet. Like, it's really worth it. This is where you're going to spend a third of your life. Make sure it goes well. Okay, while their owners sleep, nervous little dogs prepare for their day. This dog is making an espresso. You don't want to give caffeine to your dog, and definitely don't give theobromine, right? So don't give your dog chocolate. your screaming man on caffeine saying, "Coffee is my drug of choice." Just want to point this out because there's definitely exaggerated risk of panic in consumption of high doses of caffeine. If you find yourself a little high strung or nervous, or if you've got some irritation and you're not clear why, odds are high it's change in your caffeine consumption. And then when folks quit smoking cigarettes, they no longer have the nicotine. So the nicotine was a stimulant. It was increasing how fast they metabolize everything, including caffeine. So if they don't cut back on their caffeine consumption, they say, "Oh, I quit smoking and now I'm all jittery." Well, in fact, it's because they're more sensitive to caffeine. The caffeine is staying in their system longer, basically. So that's what's making it jittery, not nicotine withdrawal. So definitely, when you quit smoking, make sure you also lower your caffeine consumption. Potential health benefits. So yeah, reduced risk of Parkinson's, at least in men. I know that's replicated. The relationship in women showed up in one study, but not in another. It's not clear what the mechanism is. That's a strange disorder. Obviously, dopamine is involved. Why caffeine would have an effect is kind of indirect and strange. Reduced risk of certain forms of cancer. That's been controversial as well. Hasn't replicated. I know Dr. Hart's book, he just doesn't say that any of them are real, so I'm not going to emphasize that. Reduced risk of type 2 diabetes and lower risk of liver cirrhosis. That's confounded often with the alcohol consumption, so we'll have to see how that turns out. Some of the Alzheimer's data with coffee now are also pretty compelling. So folks between the 2 and 4 cups of coffee per day may be protected against some forms of dementia. I'm going to see if that replicates or not. Looking forward to seeing those data. Potential health risks, these are very real too. So osteoporosis and bone fracture in elderly men and women. Basically, you need that calcium to help metabolize the coffee. So obviously, if you don't have it in your diet, you're going to draw it out of your bones. Those are going to weaken your bones. You're going to be more likely to end up with a fracture. Low birth weight in newborns. And this is also a pretty disheartening finding. My wife, who had sort of caffeine as part of her identity on coffee cups and on her t-shirts and everything before we got married, and then when she got pregnant, she was really good about quitting. It was a rough couple of days, but really does pay off. This is first 3 months. I can't recommend it at all. During pregnancy, it's just not a good idea. It's strange because you see the little baby, the fetal heart rate go up. First the mom's heart rate goes up, and then the baby's heart rate goes up. And you're like, oh man, that can't be good. Panic. So as I mentioned, the exaggerated risk of panic disorder in folks who are consuming a lot of caffeine. I had a client at the VA actually, and didn't even drink any coffee. Then I realized he was drinking 19 Cokes a day. So obviously that's going to put you way over and going to contribute to jittery and nauseated and anxious. And then chronic heart disease. So at least in one big study, folks who drank more than 5 cups a day, 5 cups or more per day, were 2.5 times as likely to end up with a heart attack, which kind of surprised me. And people think of caffeine as so innocuous, but obviously at these high doses over long periods of time, it was a longitudinal study, it does take its toll. What's up with the dependence potential? Well, in fact, we really do see the hallmark symptoms of dependence, so both tolerance and withdrawal. Folks receive a capsule, they get a placebo or caffeine just in a capsule, and on day 3, 4, and 5, you get a decreased amount of vigor is one of the self-report measures they usually ask about, or stimulation. And it definitely drops by the 4th and 5th day. Withdrawal effects also observed at that low dose. So I was surprised at that because that's literally just 1 cup a day. But at around 18 hours, you'll see the headache and irritability, and it's pretty obvious it's a sign of withdrawal. The craving effects have been difficult to confirm. It's hard to know. It depends on how craving is defined. People don't necessarily say, I really want a cup of coffee in the same way they do the major stimulants or nicotine for that matter. So with that in mind, what's up with the caffeine use disorder? So the DSM-5 never really made of this. This isn't part of the usual substance use disorder definitions. We do see tolerance, we do see withdrawal, but the other hallmarks, so technically we got 2 symptoms that would qualify, but we don't see loss of control, right? People don't need to have 2 cups and end up having 7. Certainly no time lost recovering from or obtaining the drug or anything like that. The craving is hard to document, as I mentioned. No impaired social, occupational. Nobody's turning tricks on the corner to support their caffeine habit. And then persistent use despite problems. I mean, really, maybe rarely, but it's just really hard to document. So we don't see classic caffeine use disorder. I know some folks talk about caffeineism, but it's usually some jittery overdose reaction more than that than anything else. And then medications based on the xanthine. So theophylline, as I may have mentioned, is used as a bronchodilator for asthmatics. There are some other, aminophylline. Basically, it's a combination of theophylline and something else. And they use that more often. The caffeine and the migraine headache med. So Excedrin had to go through a bunch of stuff with the FDA to be able to put Excedrin migraine on the side of the box, and it had 65 milligrams of caffeine to the aspirin. But it's in there. So like if you don't realize that that's what you've got the migraine version. You take 2 of them. There's 130 milligrams right there, and that's going to keep you up. Caffeine-based over-the-counter meds, once banned in the U.S., gotta admit that's not the case now. As I mentioned, you can get the powders. They're really potentially dangerous. So some of them, literally a quarter teaspoon is 100 milligrams. You can end up taking a lot and you know it. All right. Well, with that in mind, hey, this was actually pretty brief and focused. I'm not going to get too lost in the history. Make sure you read the chapter, and I'll put up the crossword puzzle on Blackboard, and I'll put the link to the Kahoot at the bottom of this video. And good luck with it. Thanks for coming along for the ride. This was a short one.